Hi, my name is Kerry Callaghan, and I was one of the authors or co-authors that worked on this study titled Left Ventricular Mass in Physically Active Adults with a Family History of Hypertension. So coming over to our background, we decided to look at this topic because we know that having a positive family history of hypertension is associated with pre-pathological increases in left ventricular mass, or LVM, potentially due to high normal blood pressure over an extended period of time. And we also know that it's common to see left ventricular mass adaptations in athletes due to the high volume and high intensity of exercise. And we also know that physical activity levels common in habitually active adults is significantly lower normally compared to the athlete population. And due to the large number of adults that fit into the physically active population, but not the athletic population, that's why we want to focus on this specific group. And then we also know that left ventricular mass in a group of positive family history of hypertension athletes compared to negative family history of hypertension athletes have increased LVM and some other cardiovascular pathologies or pre-pathologies, but it's unclear whether or not there is a difference in LVM in physically active but non-athletic adults with a family history of hypertension. So again, our purpose here was to determine if young physically active but non-athletic adults with a family history of hypertension will have a greater LVM compared to their counterparts that do not have a positive family history of hypertension. So moving down to our methods, participants were excluded if they had any sort of known chronic health conditions or pre-diagnosed cardiovascular conditions, and then all participants fit into the age group of 18 to 32. Participants were then asked to self-report a medical history, physical activity behavior using a global physical activity questionnaire or the GPAC, and then they also underwent an echocardiogram reading, which was done using the parasternal lung axis view. And then also participants were excluded if they did not achieve the physical activity guidelines set by the American College of Sports Medicine, or the ACSM, which we use the cutoff point of 500 minutes per week. Okay, so moving up to our study results, looking at Table 1, our baseline demographic data, there were no significant differences between groups, and there were 19 people in the negative family history group and 22 in the positive family history group. The only value here that is close to significant when using a p-value of less than 0.05 was the last one right here, which shows that there is a trend that a positive family history group were more physically active compared to the negative family history group. And then moving down to figure 1, there is no significant difference between left ventricular mass between groups. However, when we come down to figure 2 and we compare LVM to body surface area, there was a significant difference, and the positive family history group had a significantly increased LVM when indexed to their body surface area. Then moving up to figure 3 right here, 3 and 4, there is no significant difference. Figure 3 is looking at left ventricular internal diameter during diastole, and then figure 4 is interventricular septum during diastole. Again, no difference between groups here. Moving down to figure 5, we have the posterior wall thickness during diastole, and again, we see a significance here at a p-value of less than 0.05, indicating that the positive family history group had a significantly increased posterior wall thickness during diastole compared to the negative family history group. Then moving up to figure 6 right here, looking at relative wall thickness, there was no significance here. So relative wall thickness was the same in both groups. Finally, moving down to table 2, the echocardiogram data for the left ventricle. Again, no significant values. or differences between groups here, just looking at some more measurements of the left ventricle and the ejection fraction. So finally, coming to our conclusions, we concluded that a positive family history of hypertension resulted in greater left ventricular mass when indexed to our body surface area in physically active but non-athletic adults. We also concluded that a positive family history of hypertension also resulted in significantly greater posterior wall thickness of the left ventricle. And then another takeaway point that we learned is that while physical activity may help to reduce or manage blood pressure, the results of this study do not show a significant benefit for eliminating the elevation in LVM commonly reported in adults with a positive family history of hypertension. All right, thanks for listening.